week's WHO Global Press Briefing on COVID.
More than 50,000 people have died with COVID-19 every week since October last year. And for the past month, deaths have remained at almost 70,000 a week. We have the solutions to stop transmission and save lives. But those solutions are either not being used well or not being shared well. The inequitable distribution of life-saving tools, including diagnostics, oxygen, PPE, and vaccines, is driving a two-track pandemic.
Executive Director, World Health Emergencies Program.
There has been a lot of talk about vaccine equity, but too little action. High-income countries have promised to donate more than 1 billion doses, but less than 15% of those doses have been materialized. Manufacturers have promised to prioritize COVAX and low-income countries. We don't want any more promises. We just want the vaccines.
Soumya Swaminathan, our Chief Scientist.
A month ago, I called for a global moratorium on booster doses at least until the end of September, to prioritize vaccinating the most at-risk people around the world who are yet to receive their first dose. There has been little change in the global situation since then. So today, I'm calling for an extension of the moratorium until at least the end of the year, to enable every country to vaccinate at least 40% of its population.
You're saying with the moratorium that you want to prolong it?
We've seen incredibly compelling data from high coverage countries, high income countries, producing countries. So where they're getting high coverage with these vaccines now, you've seen it, they are still having COVID cases, but their COVID deaths are plummeting. In the countries with the low coverage, they are still having high rates of COVID deaths. And this is what we need to change, and change as rapidly as possible. Should there be a moratorium on boosters? Absolutely. Should there be a moratorium on vaccinating people at low risk of severe disease or death? Absolutely. So our job as the World Health Organization, the Director General at the top of this, is to make sure that we call for equity for these products in every single way possible.
Do you think is going to work this time, that people will?
We're not asking to withhold something for which there is a strong set of evidence that this is needed, in fact, in order to give booster doses to individuals. The vaccines are holding up very, very well against the severe end of the disease spectrum. The actual focus of the vaccine program is to prevent severe disease hospitalizations and deaths. And we see in the evidence that, in fact, the vaccines are performing extremely well over time and against the variants, against these outcomes. So we'll continue to watch the evidence very carefully, but our expert advisory committees continue to see that there is not a compelling case to move forward with a generalized recommendation for booster doses.
Watch your extraordinary achievements. So now,
today, the Democratic Republic of the Congo declared an outbreak of meningitis in the northeastern Chopo province with 261 suspected cases and 129 deaths reported. Health authorities have deployed an initial emergency team, and WHO is supporting the response. More than 100 patients are already receiving treatment at home and in health centers. WHO has provided medical supplies and plans to deploy more experts and resources.